So, welcome to another episode of Ask Forza. We are going to dive into veterinary work at yearling sales to continue on from what we've been discussing. So you are fully prepared for facing Tipton, and if you are not, give us a call. We'll help you out. But no, not a pitch, just want to help with this video. So we're going to talk about the veterinary process at these sales, some of the things we look for, some of the things that we try and do to minimize mistakes. Our biggest goal and how we look at what we do is the less mistakes that we make, the more successful everybody is. So we really try and hone in on, not only what we think conformation is going to work, as I said in the previous video, understanding where that horse is going, who will be training it, what the ultimate goal is with that horse, and then understanding how that conformation fits the bill, but then getting very nitty-gritty in the veterinary process to make sure that we don't pick up a horse that could have an issue down the road. So Dominique has talked about this before. We talk about this a lot. It's a hot topic in the world of yearling sales, of this pass-fail when it comes to vet work. Now, we think is bullshit at the end of the day. So it's all individual. If we've made any point in any of these videos, it is all individual. There is not certain things that you can fail every horse for. There are not certain things that, and it depends on your vets. There are conservative vets, there are liberal vets. We tend to have several vets that we consult with at sales, especially when we're dealing with issues that we think could go one way or another. So we want to talk about how things are very individual at a sale. Now, another thing that you have to consider is your purchase price of these horses. That goes into a big piece. If you're going to go spend $500,000, a couple million on a horse, well then yes, you don't want to take risks on certain veterinary things. You want to have as clean a horse as possible. If you're trying to pick up stakes horses or horses that you can pinhook, then you might accept a little bit more veterinary flaws that can still work out. So some of the things as we talk about these veterinary issues is you still need to take everything on a case-by-case basis with these horses. So Dominique, what is something in terms of, let's say you have a horse with a chip in the knee and it's going to be a 2-year-old horse. Is that something that you actually want to look at?
That's such a broad question. Okay, so biggest thing is, where is the chip in the knee? The knee has 3 joints. The top joint and the middle joint, very mobile. The bottom is not. If I have a chip in the upper joint in the knee, I'm a lot less concerned than in about that middle joint. Middle joint's very high motion, and to me a chip is just like a pebble in a shoe. It's moving around, it's bouncing around, it's rubbing you raw. Eventually you're gonna feel it. So I personally think chips should come out. I don't like leaving them in horses. Anything that can be painful to them, irritating to them, I have a problem with. Also, as you can imagine, like a pebble in that shoe, it leaves irritation. Over time, that leads to arthritis. So to me, chip needs to come out. If it's the upper joint, I'd consider it. If it's that middle joint, I do generally tend to leave those alone. But then it comes down to the size of the chip. So again, it just shows it's all very subjective. You're asking if it's a chip in the knee for a 2-year-old in training horse. I would definitely have to know the exact timeline of, when that chip comes out, to the rehab, to what sale is he gonna be able to make. I'd probably put that horse on my list for a later maturing, later 2-year-old, not a 2-year-old pinhook.
So something that we have done well with in the past, and I think it goes because of Dominique's veterinary background, and those who don't know, my father is a very good vet. So I do have a background in understanding veterinary medicine. As Dominique rolls her eyes, my degree would be from Google. Most of my vet knowledge, just kidding, from the racetrack. But you do have to understand what you can accept, and there's actually quite a bit you can accept, and those are things where we are finding value in certain areas that other people might not be willing to go down. And one of it, which we've done repeatedly, is sesamoiditis. Some people get very nervous about sesamoiditis. It depends. So I'll let Dominique talk a little bit more about sesamoiditis, just to talk about, so you get a little bit more information.
I just feel like every answer I'm going to give is it depends, it varies. There's really nothing set in stone. So sesamoiditis is basically inflammation of the sesamoids, which are two little bones on the back of all of the ankles, front and hind ankles. And they're really important because the suspensory ligament comes down the back of the leg and then branches and attaches at the base of the sesamoids. So any major irritation or damage to the sesamoids can irritate the suspensory ligament. Mild sesamoiditis, I personally have no problem with it. With time and just the way the body heals, these babies outgrow it. Moderate sesamoiditis, when those vascular channels get a bit thicker, or severe sesamoiditis, severe I throw out most of the time, but moderate is you just need to do a little bit more investigating. We then ultrasound the suspensory branches to make sure that there's no break in the fiber pattern, that there's no inflammation of the suspensory ligament. So moderate, I don't have a problem with, pending, additional diagnostics.
So I want to give you an example because, as Dominique said, we'll scan horses. At yearling sales, we will scan when it comes to sesamoiditis and a couple other things. But, when we buy 2-year-olds, we scan everything because you could have a perfectly clean-legged horse that has a torn suspensory branch that you didn't know because you didn't scan. So anything we ever bid on at a 2-year-old sale has had tendons and suspensories scanned because, as I said, our goal with everything we do is to minimize mistakes and to make sure that when we're purchasing a horse for a client, that it is as best it can be to be a successful horse for them based on the scenario that it's going to go to. So one thing, and it's another hot topic in yearlings, is OCDs. And sometimes they're not an issue, sometimes they are an issue. So I did want to touch base and give a brief example of a filly that Dominique might tear up because she loved this filly at the New York bred select sale a couple years ago that had an OCD that we actually decided to walk away from.
Beautiful filly. I thought she was the best physical in the sale, to be honest with you. She had an OCD lesion in the left front fetlock. OCD lesions, they can heal on their own. Like when we see them in the stifle, we're not necessarily concerned, but the ankle, obviously being such a high motion joint, you want to investigate a bit more. Based on the location of it, based on the size, our vet said it could be fine. Most of these are, but there is about 35% where it's a horrible prognosis. They don't make it to the races. So, if you roll the dice, you'll be fine 70% of the time, but in the case of the 35%, you're toast. So we got a second opinion from a more conservative vet, said the same thing. We had our vet look at the x-rays on the yearlings that were actually done a couple months prior to the sale to monitor the progression of the lesion. And we dug a little bit more, and we actually discovered that ankle had been injected with steroids twice during the prepping process. So steroids are injected to reduce inflammation in that ankle. So to me, a yearling that's just swimming, just walking, doesn't need to be injected, period. But the fact that they've done it twice, definitely, to me, I would say that she's probably in that 35% where she's just not going to make it. So as heartbreaking as it was, there's no way that we could even consider buying her.
Well, and at the end of the day, and this was something else that, again, it was the second knock on this filly, and we're going to touch on throats just briefly. That filly had a 2A throat. Now, some people have an issue with 2A throats. I personally don't. Dominique personally doesn't. We find them pretty acceptable. But for a filly who had a 2A throat to have an issue with an OCD lesion that was potentially 35-65, and then to find out that the ankle had been injected twice, which would not only remove inflammation, it would remove pain as well. It was an absolute no-go for us. That filly turned out, she sold for $350,000 that night. I hope she turned out well for those owners. But when we get into things in throats, it's a fluid process. And as we said, everything is, you've got to think of it with every horse, what you're doing, how much you're spending, what you want at the end of the day. You can accept 1 or 2, maybe 3 different veterinary issues as long as they're minor and as long as you're not spending a lot.
And you're willing to give time. That's really what it comes down to. A lot of these things heal with time and patience. And if you know that you're sending them to somebody who doesn't have that patience, then you honestly can't take that risk with them.
So a lot of it, and we'll quickly go over grading of throats, so you understand how they grade them at the sales can be a little bit different, but normal grading of throats are?
So throats, basically when we look at a throat through the endoscope, we're looking at the arytenoid function, and that's basically the opening and closing. And so there should be full symmetry. So when the throat opens, the airway opens, it should be full symmetry. Both the left and the right should open fully and be maintained. That's a grade 1 throat. In the sales world, that's considered an A+ throat. The sales grading is very specific to sales. It's not used in the normal everyday equine veterinary scale. But basically a grade 2A and 2B throats, and then there's 3A, B, C, and 4s. You rarely see grade 3s at a sale because most people know they're never going to be able to sell the horse. Grade 2A and 2B. 2A is when there's just the arytenoids open fully, and there might be just a little bit of asymmetry, but then it fully opens, so there's nothing to worry about. A grade 2B, there's a little bit of asymmetry, and then usually like when you hold off the nose on a horse and they do a really great big inhale, they get full symmetry and abduction. But some people start to get a little bit funny about 2A and 2B throats. It just all comes down to what you can live with. Just very subjective opinions.
So why we discuss throats at all, for those of you who are new to the horse world in terms of understanding this is airway. And basically we need to understand how much air that horse can get, because that will very much dictate how quickly they fatigue in a race. So it is a big deal, which is why we do want to understand how well that throat functions. They do change. Some can get worse, some get better, not always get better, but basically.
But they can even change during the course of the day. You scope a horse at 8 a.m., it's the first scope of the day, it has a grade 1 throat. If you have 20 vets scoping that horse, by 3 p.m. it could have a 2A. So the throat does get tired. It's not always, it's fluid.
Well, and we have done that too. That is something we have done at sales when we have had horses where we're slightly questionable of. Dominique, in the past, she doesn't do it as much anymore. She used to carry her scope on her neck. We do have third-party sales vets that we work with, but at times we'd say, you know what, let's get there early. Let's scope that horse first thing. Let's see how that throat looks, because we're questionable on it. Let's see what it looks like now, and then let's do it at the end of the day once that horse has been out all day long, because we want to, as I said, we want to get as full a picture as we can of each one of these yearlings before we make that decision for a client to raise their hand in the sales ring. Because once they get into racing or once they get into prepping, whatever decision you made is what you made at that time. So it's such a short window that we have when we're at these sales, seeing these horses for a couple days, that we need to make sure we do as much work as possible to make sure that that client is investing their money properly once that hammer drops and that horse does become theirs. So veterinary issues, as we said, they are subjective. It can be based on where the horse is going. Is it a pinhook horse? Is it a racing horse? Is it a horse that's going to be somebody's going to be patient with to then race later on? Do they want it ready early? So is it going to be going to Europe? We do buy horses for people to pinhook in Europe. Those are different things that we look for on those yearlings that we can accept over there, because they're being prepped on turf and poly track versus dirt and sand. So all of it plays a role. So yeah, I think we try to cover as much as possible. We could go, Dominique's got 3 pages of a list here, so I won't let her talk about the varying degrees of sesamoiditis and all the different chips that you could have, and different plantar ligaments, in terms of all these other things. So basically, we're going to call it here on veterinary issues, but hope this video helps you out. Thank you very much.